When a child is born with heart defect, it's really a difficult time for them.
These babies don't feed well.
Most times they're very sick.
They don't grow well.
Tired most of the time.
Shortness of breath.
Difficulty breastfeeding.
Cannot play with other children their age, so they tend to be isolated and feeling so disadvantaged. I know this because I was that child. My name is Grace Aguero, and I'm the very first child to receive heart surgery with Gift of Life. I was 5 years then.
Since that day, Gift of Life has helped over 30,000 children from 79 countries, spanning over 5 continents. I am Rob Railman, the CEO of Gift of Life International, and we are a nonprofit organization with our mission to develop sustainable pediatric cardiac programs and to empower doctors and nurses in their own countries to take care of their own children. Congenital heart defects are the #1 birth defect in the world. 1 out of every 100 births, there's a child who is born with a congenital heart defect. And 93% of those children are born in a country that can do nothing to treat them. We focus on helping children in need all over this world. From remote villages to dense cities, from Eastern Africa to Central America to the Caribbean and Eastern Europe. Areas where children have very limited resources for life-saving healthcare. El Salvador is a shining example of where we see our success. In El Salvador, we have worked with the local government, with the hospital, with the healthcare professionals, and an on-the-ground NGO to ultimately develop one of the strongest self-sustaining programs in Central America. Ivan Lopez is the executive director of our affiliate in El Salvador, Latidos de Esperanza.
Our main focus always have been to give the opportunity to the Salvadorans to do the job that they already know how to do. They just need the resources to provide them supplies, equipment, train them. Without the partnership of Gift of Life, a lot of children wouldn't be alive.
Every month, Yvonne coordinates our nutritional program in El Salvador, and this is crucial to stay in touch with the children, to track their growth, to ensure that after surgery, these children have the proper nutrition to become healthy and strong as they get older.
Not only we have healed their hearts, but we have changed the life of their whole families.
Gift of Life could not be Gift of Life if it wasn't for Rotary. And the work that they have done and the leadership that they have shown in bringing attention to the need for a pediatric cardiac program, they have seen a vision and they really have been the beacon of hope for many, many children. The program in Uganda gives us great pride. Not only was our first child ever from Uganda, but we now could show the great comparison of how we can now take care of children in Uganda without them having to travel to other countries. We are very fortunate to have Dr. Michael Okecho to be our partner in Uganda. He is an example of a young, vibrant doctor who really wants to give back to his community.
So Gift of Life helped to empower us to run the program on our own. And you're able to reach more patients. Being able to give a child back their life, it's a tremendous privilege. Brings a sense of joy that you cannot measure.
When you're able to provide a program and give the resources to doctors and nurses that they can ultimately use their training to help their own children, it's a tremendous feeling for them to really believe that now they can do what they were trained to do. What has made our program in Romania successful is that the partners really have come to the table and produced. You have the city of Bucharest that has provided a world-class facility. The Ministry of Health of Romania that has allowed for state-of-the-art equipment to be put into that facility. And then you have the support of the local hospital to employ a team that now is able to operate and treat ultimately hundreds of children. There are times when certain parents grab your heart. Recently in Romania, I met a mom, Andrea, with a little girl, Jessica. And she, by herself, took her daughter to 3 different hospitals and pleaded for them to help her child. And the first 2, she was not successful. But the last one was during our training visit.
When she plays, the heart is beating very, very fast. I was very scared, and worried. I don't know what to do.
And the fact that you can help that mom realize the dream she had to bring care to her child, that's why you don't stop. That's why you keep on going to the next country and the next country. That's why you keep on asking people to help you, whether it is with their time or their money. Because at the end of the day, it gets down to be as simple as that. You can save a child's life if you have the resources to do so.
I am very thankful to the doctors that help us to make the children okay, to repair their hearts. This is a big chance to us.
While there are core countries that meet our guidelines, there are just certain countries that we cannot turn our back on. And probably some of the greatest work that we feel the most proud of is what we do in Haiti, because no other non-governmental organizations are in Haiti today providing open heart surgery and cardiac care to the children of that country. The director of the hospital in Haiti, Dr. Jacques-Claude Ngoutier, is truly one of the great advocates providing health care in a very, very difficult setting.
When I look around my country, providing health care for the population is a huge challenge. I can attest of the despair sometimes that I see on mothers' face, because oftentimes when they come here, they've gone to 3 or 4 places where access was denied. The partnership with Gift of Life is a success. Building the capacity of our institution in terms of equipment, in offering training for the staff. So without Gift of Life partnering with us in Haiti, thousands of children would die.
It's impressive that Gift of Life has ventured into Haiti through humanitarian efforts, knowing that there's such desperation for these children. I'm Dr. Gabe Owens. I'm an associate professor in pediatric cardiology at the University of Michigan, Congenital Heart Center. Gift of Life has been tremendously impressive. They are the leaders in helping to develop sustainable programs. They identify the need, they identify the infrastructure that's needed, and they make it happen. I have been incredibly proud to work with a principled and dedicated organization such as Gift of Life. I couldn't ask for a better partnership to do this work.
A great part of this work is to see the children who have been treated through our program and now are flourishing and happy and enjoying their life. Being there when they get together to share important milestones is a tremendous feeling.